Hi, and welcome back to the Entangled Health Podcast. I am your trusty host, Madison Murphy Barney. Excited to be back today talking about Swiss cheese, which will make sense in a couple minutes. But before I jumped in, I wanted to talk about having some availability for Story Lab sessions in the coming months. It's such a great way. I don't know about you, but I feel like now that it's like I'm recording this the end of January, January 26th, and like this is the first week that really feels as though the year has started and I'm not just like dealing with the backlog of things that I like delayed from last year or needed to be put off until the beginning of this year. It really feels like, okay, here we go. And if you're in a similar boat and ready, like to vision and dream and scheme about what might be possible for you and your teams this year, a Story Lab session is a perfect way to do that. And I had one a couple of weeks ago with a client, and they just booked the session. It's a 3 hour session with some decision makers on their team, and I walk them through it, and then and so it's the same thing I would do with your org, walk you through these questions and have an inquiry process and a conversation process that looks at just like your current systems, what's possible, where opportunities are, all of these different things from really front to back. I'm inherently a nosy person. So we like really get in there and look at stuff. And then I compile all of the notes and findings. And then I create this beautiful brief that has, with your current operations, with your current capacity, with your current budget, what's possible, where you can implement story driven strategy, different storytelling initiatives, trust building initiatives. Um, it's only 3 hours of your time, but it's so much clarity for the year ahead. And I had one client who used it then to formulate their 5 year strategic plan, which I supported them on designing and implementing. And folks just use them really as the backbone for so much of their work planning for the year ahead. So, this January, as we move into February, is the perfect time to really start thinking about that and thinking about what might be possible in 2026. And I think, the key part of it, right, is that it's only 3 hours to, sometimes two of your team's time, that extra hour added on there for, the begin or the logistics and getting things sorted and things like that. And then away we go, and you can have a clear, concise path forward for the year ahead based on what I've seen in other organizations and what I see specifically in yours. And that's the thing, is each session is tailored so much to your team and your organization that you can just then use the findings to chart your path forward for 2026 and end the year feeling like you got the clarity you wanted, you're making the impact you want, decision makers are responding to you, funders are responding to you, and you're just set to go. And then like it's that cycle I always talk about, once you have that story driven strategy and thing and that trust building, then it really feeds that ecosystem of more impact, and more impact, of course, that has, decision makers even more excited to include you and to fund you and things like that. And it just carries on, and staff feel more engaged. And so it's basically a no-brainer. It's a wonderful way to spend some time together, start the year. And so do reach out if you would like to spend some time together in that session, and we can just get some clarity. And one of the my favorite places to be, especially if you've listened to the episode I did on why you should hire a doula for strategy work, like my favorite, most comfortable place is that uncertainty and that possibility. And I know for some folks it just can feel really overwhelming. And just know that I've got you, and we can walk through that together. And you don't have to worry about making sense of the uncertainty and what feels like all these scattered parts. Like that's my job, that's my zone of genius. You just have to answer questions about things you know best and how your organization works, and we can figure it out from there. So do reach out. I would love to spend some time together, just a couple hours, and you'll be set for the year, or in the case of my other client, the 5 years to come. So let's do it. And so, as I promised at my intro in the beginning of the episode, we're going to be talking about Swiss cheese today. And so, so often we see in public health, this idea that like this one fix, this one thing is going to be the thing that upholds health equity. And maybe in all of your scrolling in the past couple of, I think I saw it for the first time a couple of years ago, there was this idea of the Swiss cheese model of self-care. And it was the idea that there's all these daily stressors, and then everything we do to take care of ourselves acts as a piece of Swiss cheese to protect us from the daily and life and societal stressors. And so no one thing, no one practice can be the thing that holds us from and protects us completely from life's daily stressors. And some things are inevitably going to get through all of the holes of the Swiss cheese, but these layered, non-matching holes like Swiss cheese has makes it so that we have some protection. And so I started to think um, about that in terms of health and public health, and how, really public health so often treats these when things fall apart or our system's failures as individual gaps instead of like that systemic misalignment. And so we over rely on these single solutions of a new clinic or a new program or a new policy, and then, don't really quite understand why outcomes don't change. And so I started to think of health. And as we all know, like, especially when we have an expansive view of caring work, public health is it's the folks who fix people's homes so that at a lower reduced cost so that they can, stay in their home. It's people who provide transportation. It's the folks who are making meals. It's the people who grow the food for the food pharmacy. Like, it's so many things. And so if we think about health as all of these multiple imperfect layers that work together, we get a lot closer to that health and that protection that we want for our communities. And of course, like Swiss cheese, every layer, every slice of cheese has holes. No one layer is sufficient alone. We all need each other, and we all, things fall through one hole and are protected by the next non-aligning hole. And so that protection comes from alignment and not perfection. And it comes from understanding that we are part of this ecosystem of these many slices that protect folks rather than trying to do everything to be the one slice, the one block of cheddar, let's say. And so I came up with these four letters that are the main slices of cheese, let's see, that make up public health. So the first piece of cheese is access to responsive care and services. So this is care that's timely, it's culturally responsible, it's culturally responsive as well, and affordable, accessible, all these things. So as we all know, access alone doesn't equal health, right? We need more than that. But having access to this type of care protects our individuals and communities from, um, you know, not having the care they need, not having places to go when they need care, and not having care that doesn't sufficiently meet their cultural, timely, and financial capacity and ability. So then in addition to that care and services, we also have, and that like, right, to go back to that piece of cheese, we're thinking again this expansive idea of care. So it's not just like, oh, that all comes from one health center. It's like it comes from a health center and insurance and larger hospital systems and that whole ecosystem, and then like nonprofits and justice organizations, and everybody who's in that ecosystem creates that accessibility of responsible care and services. And that services part is key, right? Because we know like so many different services are what make up our care, individual care, community care. So the second piece of cheese after access to responsive care and services is an ecosystem of community support and opportunity. So this is mutual aid organizations, social connection, economic opportunity, and this is places where people are held between appointments or like formal or informal interactions with the system as we know it, the system of care and services in the first piece. So this is, when we have communities who have the resources and access and all the things they need to support each other, to feel connected, to feel like they have the time to be connected, the space to be connected, the ability to cook for each other, care for each other, look after each other, and that real social cohesion, that infrastructure we talk a lot about, that can really support people in feeling like, okay, I have health because I know that if something happens to me, that I can they're organizations and formal and informal and groups of people and my people who they've got me and I have opportunities to care for myself and the people I love and, sort of go like be included in that cycle of care. So like I'm cared for, I care for others, and there's a lot of importance in that full ecosystem. So that's our second piece of cheese. Our third piece of cheese are policies and practices that see and serve us. So going back to the first one, we have this access to responsive care and services, but we also, those really stem from policies and practices that meet those needs and that create the conditions for the services we need and the ability for our ecosystem of community support and opportunity to exist and thrive and be healthy. So that stems down from, if we think of like upriver and downriver, um, upriver solution are those policies and practices that really honor who we are as a community, as individuals, our rights, our needs, our desires, our protections, all of these things. So, what this comes down to is we need policies that reflect lived realities. And I was talking to this woman on the phone the other day who runs this really cool organization. And she was talking about on her organization's website, it's that only 18% of families in the United States are a nuclear family with two parents and children in a single home. And yet, when we look at all of the policy that is written and implemented in, across our country, it's all focused on that family unit. And we just had the most beautiful conversation about the expansiveness of family and family building and what it means to, to change that and what that looks like for housing and education and health and all these different systems when we are and people's finances and just everything when we are creating policies that do not reflect the lived realities of the people who they're created for. And so that again comes back to um, the need to listen deeply to our communities and the wisdom and know their lived experiences so that we're not creating policies and acting from, and even with well intention, acting from a place of assuming that everybody's operating in a certain way that they're not indeed operating from, be it with their housing, with anything, with everything that become those social determinants of health. So I just thought that was so interesting that we know and we can sense, I think, a lot of the times that the policies around us aren't made for us. But as organizations and as leaders in organizations, while we can't necessarily always change policies made at larger scale, we can create organizational policies that do really reflect the needs of our communities and the desires of our communities. And, these are, of course, practices that reduce harm rather than create bureaucracy and challenges. And these are really practices that care for our communities and hold our communities and it's that and it's both things. And maybe I've mentioned this before, but one of the most impactful moments in grad school, I was thinking about this the other day. I was like, what did I learn in grad school that I still remember? And this one anecdote, there are a couple things, don't worry, but this one anecdote, I've come back to it over and over and over. And it was something that my advisor said in a class. And he said that there's no such thing as a broken system because every system gets the exact outcomes it was designed to get. And that just made everything make so much sense to me. Because it's not that these systems are broken, it's that they were designed to not function and to not serve folks. And so when we are systems makers and decisions in systems, then it's our job to create policies, one that reflect the lived realities of the folks that we are in service of, but then at the same time, practices too, because policy and practice can look a lot different, right? It's like we can so often there's that miscommunication of a policy is drafted and enacted, but how it gets played out can get wrapped up in bureaucracy and other steps that don't make like intuitive human sense. Like one example I'm thinking of from my personal life right now is I am in the process of selling my house. And one of my really frustrating parts of that process to me is that like all like humans are a part of the system, but like there's nothing human about the system of selling the house. Like it's just so unintuitive and connective, disconnective and things. And it was just like we have all of these policies and practices in place that make it so that like that system, there are organizations that it serves, but the individuals selling and buying the house, I feel like are not served by that system. So that's an example as well. And so we want to create humane and human-centered and wisdom-centered policies that have the opportunity to be translated into practices that are also reflective of the communities we serve and actually serve them and aren't just like have fall into that disconnect of from what's written to like what's enacted. And then that fourth piece of cheese. So we just to go back, we have access to responsive care and services as our first piece. We've got an ecosystem of community support and opportunity as our second. We've got policies and practices that see and serve us. And then that fourth piece of cheese is a healthy, abundant environment. And that is our physical environment, land, housing, transportation, places to connect, to rest, to move, to belong. And, it's really important. It's not just the environment, but it's that we can connect to that environment and spend time in it with folks that we love, folks that we are in community with, folks that even if we can't stand, we still are in community with. Those places to connect, those places to like enact those policies and practices that we want to serve us, that we hear and learn about systems and of community support and like the space and environment in which we can really steward our community, steward our connections, and further that access to responsive care. So, as I mentioned at the outset, we're dealing with that Swiss cheese model. So each layer matters and each layer fails on its own, right? Like these layers all need each other to protect us and to keep folks healthy as individuals and communities. And health happens in that overlap, right? It's not in the individual slice. And it's you could be your organization maybe is just in one of that slice, but you understand that you're connected to an ecosystem of and that your life is a part of an ecosystem that has all slices. And so, it's important to think of like the holes are not failures, they're the realities, right? Like gaps aren't mistakes, they're what happens when systems meet real life. And they are that not every organization, every individual is being meant to be doing everything all at once. It's that we need each other and we create this ecosystem and this wraparound like vessel that can hold our communities and keep us safe and healthy. And it could be that there's a clinic that's excellent, but I think of like the rural context I live in, like it's hard to get places. There's a lot of inaccessible areas. And so then it's like, okay, then we need, additional systems that provide transportation that is reliable. And, um, or I think of, so, where I live, mutual aid is a really big thing. And there's all these channels for mutual aid and folks supporting each other. And that strong community network is really important, but there's no institutional power or funding for it. And so, institutional power is going to fund other things and other priorities, but we need ways for them to work together and to coincide in that way. And so often what I see is that, public health as a large entity and justice organizations are blaming individuals and adding other isolated interventions without looking at the full system and the full block of cheese that's needed to protect our folks, keep us healthy, keep us safe. And so with all of that in mind and with all those things I was thinking about, the work I do with story-driven strategy, and I really see it as the wrapper, right? It is that like we don't just put our cheese willy-nilly in the fridge. Our slices of cheese, they have to be held in something. They need a container. And story-driven strategy in the case of health and justice is really it's that wrapper. This is the core. And so in every model, just the cheese isn't enough. We need that wrapper that holds the layers together, gives them form, and protects against fragmentation. And also protects against having a smelly fridge, because if you just put cheese in the fridge with no container, it stinks. And so, you know, if you've been around here for a while, you know that story-driven strategy, isn't just marketing and testimonials and nice to have. Story-driven strategy is all around like how systems listen, how they see patterns, how they decide what matters. And it's that deep listening and then building strategy based on that deep listening and wisdom from the community about what folks need and want and desire and demand from the systems that serve them. And so story in this way, and I've talked about this before, adds infrastructure. And that story is not, it's not that fluff. It's not that nice to have. It's that infrastructure that holds things together so that we can further learn what the different pillars of our health system need in order to fully provide that protection to become that block of Swiss cheese. And so, what story structurally does is it reveals where the holes actually are, and it shows how the layers interact in real lives. And it gets back to what I was talking about before of you can't just be like, oh, okay, based on our assumptions, we create this policy, and then this policy, because it's based on assumptions in practice, is not going to be effective because it hasn't, you can't practice something that your community doesn't have space for or a need for or time for. We can't create policy in a vacuum. And so when we create it in response to story and story driven strategy, that's when we get real policy and real practices that can be enacted, with ease and impact. And so when we don't have a wrapper for our cheese, these programs start to compete instead of collaborate, and they're all trying to be fully, not stay almost like pretend there's no holes, and that it's up to them to be the whole system, but it's not up to anybody to be the whole system. It's up to all of us to like create this vessel that has less holes and covers each other where the other doesn't have capacity or the skills or the tools or even the desire to fill. And so um without having this like structure and this infrastructure of this wrapper, our communities are engaged, but they're not centered and they're not responded to. So we can't fully understand them unless we've got like the wrapper around that's holding the structure. And with a wrapper, story becomes that infrastructure, becomes that shared intelligence, and it's grounded in that lived experience, and then alignment becomes possible. And it's that thing that I always talk about over and over and over. It's that, when we deeply listen to our communities, and our communities, of course, include the folks who we work alongside in the work. Those are our communities. So often there's this false divide put between community members and the folks who like work in our institutions, but like so often they are the community members, and they are people with lived experiences that we need to know about, and they are the ones carrying out this work. So they are the ones whose insights we need, you know like as prominently as community. So when we have um, all those insights and we listen deeply and we create a strategy from there, then we create a really strong strategy that already has buy-in. And when you create a strategy that has buy-in, implementation is so much more powerful. And when you have powerful implementation, you have powerful impact because folks are coming to programs that they, spoke on needing, and they're, attending your clinics and your health and your health initiatives and other programs that you might offer in a way that they feel ownership in, because they, in some sense, co-designed them by telling the stories and sharing the wisdom of what it was they needed and wanted. So then you've got that increased impact because you created a store strategy based on what folks already wanted and said they needed. And as we know, every individual and community are the experts in what they need to be well. So we do that, got this increased impact. And as you know, once you have increased impact, funders' ears perk up. Decision makers, love to see it. They can pat themselves on the back for, like the work that you're doing, and being, a decision maker in the realm of of your work. And so then like that gains more attention, and then your impact increases even more. And then you continue to deeply listen and iterate, and you feed that really healthy cycle of story-driven strategy. And so yeah, in that way, it's like that protective wrapper, right? It's like what holds together and makes sure that like there's safety and security in all of these layers of protection of our health. And so um, it look different in practice for every organization, and that's why I'm so smitten with these story lab sessions, and I'm just seeing so much impact from just a short time together of listening to folks and creating opportunities for them to further listen to their communities and implement and create a strategy based on that, because it's like that keeps this holistic, protected, um, and held system that we all need to be able to rely upon. And so this whole thing is why I do the work I do. And it was just fun to think of it in the context of a block of cheese, especially Swiss cheese. And so, you know, this in this work, especially in particular in the work I do, what I'm helping organizations do and my partners do is ethically, carefully, beautifully gather stories, interpret those findings strategically, and then also use utilize the stories and share out the stories with decision makers and with policymakers, through edited versions and pull quotes and audio versions and videos and all the different things we're using to have that authentic storytelling that really moves folks. Because as we know, like stories move us, data doesn't give us goosebump, stories do. And then that those strategies are used to just align our systems so they don't just tell better narratives or tell better stories, but really align our systems to what we're learning from community wisdom. And so, that's where that wrapper comes in, and that just holistic like holding of our block of Swiss cheese. So, um, I wonder, like, if you were to think of your system and the systems you create in layers, what might some of the layers within your system, I laid out the big pillars of public health layers, but what are some of the layers in your system that you're thinking of, and where are those holes? And, where can you add in extra layers or, and not just like to duplicate efforts, look around at the community and where can you collaborate so that the folks you're working alongside have that extra care, that extra protection, and that extra access. And I say it all the time, but when we get serious about health and equity and impact, story is not fluff. Story is not a nice to have. It's the true infrastructure of that. It's the wrapper of our cheese. It holds it all together. And so yeah, it was just fun to explore that and this thing I think about all the time through a different model. And thank you for coming along on that journey to me. And as I mentioned in the beginning of the episode, would love to sit down with you and do some of this visioning and dreaming and scheming through a story lab session where you step into the story lab and it can be there in person, it can be virtual, and really just spend some time together, um, taking stock of what's available to you and what's possible for you too. Like it's very much a session where it's like what is going on and understanding that, and then also what is possible with the bandwidth you have now, the budget you have now, and everything. And it just can really add so much clarity to what sometimes feels like this ever changing and ingraspable reality of an organization, because our organizations are these living and breathing entities. And so um I created actually a drawing of the Swiss cheese model that I talked about today with my wrapper, and so that will be on LinkedIn in the next couple of days. But until then, thank you so much for coming along on this very extended analogy with me, and I would love to hear your thoughts. Feel free to comment or send me an email. All the information is in the show notes, and would love to have you rate and review the podcast or share it if things are resonating with other folks who you think it'd be of interest to. And thank you so much. Take good care. And if you are in a place that is as snowy as where I am right now, I hope you're enjoying living in a snow globe and staying warm and staying safe. And I look forward to seeing you back here in a few weeks' time.